Maybe before they're ready, one more thing. So some of you got confused if the patient is not blocked. If the patient is not blocked, great. It's just one layer of problems that you don't have. Yeah. If the patient is not blocked, you go to switching, and then you go to the organ scan. Yeah, and do that. Yeah. And then some people got confused. Well, if I do the organ scan and everything is nice, but something blocks, that's exactly what we're looking for. Yeah, that's not. That's what we're looking for. And then you tap on whatever blocks. And when you have the Portafilter off, you got a weak arm, so you got a strong arm, and you do exactly the same thing. Once you do it with a weak arm, then you do it with a strong arm. Every sequence is the same, with one exception is the block regulation is only once. When that's done, you never come back to it, not on that treatment day. Yeah, okay, you guys, are you ready? Okay, so we want to show the basic form of the A.R.T. testing. This is when you are not able to lay the patient down, depending on your license or the circumstances, or you may be in a cafe where somebody has suddenly developed chest pain, you want to check out, help them to see what it is. You know, so very often we are forced to treat people or do an assessment in a sitting position. You know, so I want you to show you how to do that. So first of all, we calibrate. You know, so we do indirect testing only. Come a little closer, a little more behind her. Okay, and so remember, like when we're testing, we're not doing the pump handling. I'm leaning my weight onto her. For me, that's very easy because she is smaller than me. If you have a tall person, the arm will be way down there, you know, of the person. You know, so some of you have not gotten that. The other mistake that I saw is that most of you are still too high up on the arm for testing. The contact point, when you bend the wrist, there is a number of small bones here. And this area has a tremendous amount of sensory and autonomic innervation. And by putting the palm of my hand and cradling that area, it's not only a mechanical thing, there is a transfer of biphoton information into my system that's incredibly valuable. And at least 2/3 of you have missed that point. You know, you're still just beyond that point where you're missing all that precious transfer of electric and light energy that comes into your system. You know, so that's the first mistake. And so I'm in the correct position. I'm leaning my weight on her. We calibrate until there's no movement, yeah, until her system learns how to counter my exponentially increasing pressure, which I generate by my weight, with an exponentially increasing counter pressure. As long as you see a movement up or down in response to my push, we're not calibrated. Yeah? The calibration point is pretty good sized weight of me leaning on her and no movement in the arm. That's what you need to come to. And you need to entrain the intermediate person, or if you test on the patient, you need to entrain them to get to that point. That may take you 10 minutes, but it's the most important, crucial 10 minutes you ever spend in your life with the patient. Yeah, because that's a precondition to have an instrument that works. Okay, well, next step is the placement of the Portafilter. When we're working in a sitting position, there's 3 positions that work. One is on the forehead, one is on the thymus, and one is on the belly button. Other positions will also work, but it makes the testing much more difficult. The difference between strong arm and weak arm will be much less and will be requiring much more proprioception on your part. And so most of you that are watched have placed the Portafilter here. That's not where the thymus is. Yeah, the thymus is, just feel it on yourself, like the upper end of the sternum, and it's immediately below that. Yeah, it's not down here. Yeah, and so let's do that and place it there. And the only thing that makes it not work is black clothing or electromagnetic shielding clothing in all colors. And you make sure that the point that gives you the linear orientation is either up or down. Okay, so So she is not responding to my push that I calibrated before. The arm is not giving. So now I contact the 10 acupuncture sections. Was that a word? Segments, sorry. The acupuncture meridian segments, and so I start with the straight line on top of the head. Certainly one of my fingers should be on top of the head, the governor vessel in acupuncture, that is not opening the system. Then I test the upper orbital ring. It's not the eyebrow, it's just below the eyebrow, or depending on how old you are, and when the eyebrow starts sinking, in my case, the eyebrow and the rim of the orbit is the same. But the younger you are, the eyebrow is higher up than the bony orbit. So it's the bony orbit that you're looking for in the eyebrow area. And I'm curling all my fingers around that, all 5 fingers testing. And this is where the arm gives. And so, unfortunately, in this, I have in acupuncture terms, the point bladder 1, bladder 2, gallbladder 1, but I also have the whole orbital ring. And some German brilliant acupuncturists found that there's a whole organ representation in there. So in truth, I'm testing all the meridians or all the body structures by touching here, and I cannot clearly relate it to bladder and gallbladder. It could be anything, and so, but for the treatment, it's not important. We're just assessing, okay, this opens the system, and it's important to treat it. But for now, we just do an assessment of all the points. So this one is opening, the gallbladder not, the line behind the ears not, the stomach line is also opening, the upper teeth also opening, the lower teeth not, the side of the chest not, the kidney meridian not. Okay, so we have the eyebrow point, we have the stomach line, what else was there? And behind the occiput. And so we tap the points in sequence, 33 seconds each. So start with the eyebrows and tap and tone. Sometimes I remind people to change the pitch of the voice. She's in a good middle pitch, but you realize sometimes that people are avoiding certain things with the pitch. It's usually by going too high. And the general instruction I give, no, try a lower pitch. And that's impossible for people that avoid connecting to traumata and unresolved psychological issues. With the pitch of the voice, they can avoid activating that section of the vagus nerve that will make the connection. So, but she was good. Okay. And then, and behind the ears, and try a different pitch this time. Go a little lower. Yeah, good. You could do it. Switching the pitch is very, very difficult when you're in the arena of accessing traumata and unresolved issues. Okay, and then this one was a little less than 33 seconds, but we're probably okay. While you're tapping, you keep tapping. Okay, you can let go. So she's definitely open. I can, as a practitioner, quickly test here, but then we go back to the system and hold this with your right hand. So we got nice open regulation, and then before testing the organs, you do the switching, that comes
before
first.
Testing the organs.
The sequence is always opening regulation, switching, and then the organs. So she holds the thumb and little finger, but not like a monkey, but make it round, When people have long fingernails, you can't do it, So, and it's a step that's sorry for the patient, but we can't do it. Cut your fingernails. So she's going back into blocked regulation when we do this, And so do the other side. And she also goes back into blocked regulation. There's a special thing here that is a tip that she is in a state of autoimmunity. That means her immune system is upregulated. She probably has equivalent of mastocytosis, mast cell problems, and all the things that we know about an upregulated system. Yeah, and so it's going to the next tapping point that we find to correct that is going to be life-changing for her. This is not a small thing. If you find a point, it's not always possible. So keep holding it.
Hold your. Yeah.
So always watch out. The patient will always unconsciously twist the thing to be afraid. You know, the brain is always doing the best it can do to keep you healthy. And when the brain has disarranged your system, that's the best the brain knew how to do, and the brain will protect that position with every trick in the book. Bending the arm, humming at the pitch that's not touching the issue, twisting the pull filter while you're not watching. This will be like a child, you know, that's trying to get away with something, and watch out for that, you know. The brain is not working with us initially, you know. It's the tricky coyote kind of thing hiding in there, is trying to hide the problem. Okay, so she holds the ring together. She holds the pull filter. She's back into a strong arm. That means the biophoton emission in her body is not right. Yeah, it's chaotic. And so now I go through the tapping point and hopefully find which one is the one that's missing. Yeah, it's the one that we actually left out. It's the upper teeth. Suspicion, of course, is that there is an interference field in the teeth, that there may be a devitalized tooth, there may be a cavitation, there may be a root canal, there may be some filling materials that your body doesn't like, but it's a huge issue in you. Yeah? So let's do this. We take the pull filter away and tap with both hands. And the more sophisticated amongst you, you can actually test the pitch of the voice to see which one actually corrects the tone. Yeah, this is the higher art of this. For those of you a little bit more musically inclined, you know, it's a wonderful way that, you know, and if you have an instrument there or you have objective hearing, you can actually say, well, this is whatever the middle C or the middle B on the piano, you know, and then you can find the tone. Yeah, but this is sort of the higher art of this that we don't need to. Okay, let's see if we resolved it. That was again a little less than 33 seconds. It's like when you tell a teenager, you know, you have to brush your teeth for 2 minutes. And then they did a study on that, you know, having teenagers estimate when the 2 minutes are open. None of them did it more than 30 seconds. Thing is 2 minutes. Yeah, so 33 seconds initially, you may want to actually have a watch there with the second digit. You know, okay, so it's good on this side, and then change over. Yeah, and she's good on that side. So it did resolve it. So it's either tapping here 4 times a day. You know, I mean, I would do the whole thing, you know, which is 2 minutes, a little bit, 2 minutes and 12 seconds. You know, so it's the whole time that we're requesting 4 times a day for 6 weeks. But I would have somebody look at the teeth also, you know, there's something slumbering because it's causing autoimmunity. It's a huge issue. Yeah. Okay, now we're through the switching. Now is the place where the organ scan comes in 3 layers, you know, close to the body, a foot and 3 feet away. And so, and everything, that your brain in 3 places, thyroid, lung, mediastinum, spleen, liver, gallbladder, stomach, pancreas is that 45-degree line, small intestine, large intestine, pelvic floor, and kidneys on this layer, she's fine. And you will see that when you start with tapping, that very often things clear on this level. That's the level that we usually correct with and tone. The next level, if that's testing, that's a level, usually the level of toxicity or acute, subacute symptoms. You can find acute flu or strep infection, you can find there, but not the chronic ones are in the cells, but the active ones may be straying into the matrix. So just keep that in mind. On this level, we only look for two things. I look for zeolite and chlorella. If anything, tests there. It'd be good on this level. But if I would find a blocked thing here, we could use her hand to test the points with it, and very often you can still find a point to clear that. But it's better to go straight to the binders, or if you want to make a diagnosis, the 4 common toxins, to test that, and then test the chlorella and the zeolite. It's rare that you don't find that to be the right solution. Okay, and then the third layer. She's good. Now we take the pull filter off. We calibrate. We got a nice strong arm. And now we go back to the switching. So the only thing we don't do on this level is block regulation, because that's done with the pull filter. When the pull filter is off, we can't do block regulation because we solved it. Now we do the switching. On the right hand and to the left hand.
Let go of the other one.
No, it's good. So she's perfect now. So we learned a few things with her. We learned, okay, this was several of the meridian sections that we're testing. And we could interpret that the organs related to that are weakened. But it's enough to do the tapping for 6 weeks to strengthen them, to bring them back up into their strength without the use of medicine. Any kind of medicine, without the use of osteopathy, acupuncture, massage, and all the other things. We delegate it back to the patient to do that treatment. The other layers are the ones where she may need some help. And so we went through the switching, that was okay. Now again, the brain in 3 places: thyroid, lung, mediastinum, spleen, liver is testing, stomach, pancreas is testing, small intestine, kidney. So you got the liver and the pancreas testing. If 2 things are testing, I would like to show that to you. We like to prioritize. It's usually one causing the other. And to find that out, we use a little trick from applied kinesiology. I have to give credit to them for that. And so what she does with one hand is the middle finger and the thumb to touch the same tapping point that we use for the kidney. It's called kidney 27, is roughly the location. She holds it, and we repeat the testing of the 2 organs that tested. So the liver is still testing, the pancreas is not. That organ that is still testing is the one that you treat. Okay, so how do we treat the liver? At this stage, we have 2 options. She could tap here, your gallbladder, liver is here. She
and
could
you have
just
the tapping points and the related organs in the sheets that the calendar distributed, right? So you can use
cool.
that to help yourself.
That's a golden sheet that you have.
Which we need back, by the way.
Oh, they don't have it yet.
No, I give it to them, but they need it to. They can use it for practice. It's fine.
But what are they going to do at home?
No, it's then in the handout.
Oh, I see. It's in the handout. Okay. So one option is to do this. A better option at this point is that she actually, with one hand, usually across the midline, holds the organ. So she holds the liver, where it actually is, and you can push it up a little bit because you're not afraid of your own boob. So as practitioners, we have to kind of sometimes be a little bit away from the location just for the obvious reasons, for the Me Too reasons. And with the other hand, you tap like 16 and a half seconds on one side and 16 and a half on the other, making a tone. And in this situation, to really Now we're really deep into organ healing, yeah, to imagine the tone coming out of, as if the liver could make the sound. You project your attention on the liver as if the liver is making the tone while you're tapping. Okay. And most people are incredibly good in finding the right pitch of the voice when you're actually down to that level. You know, to find the pitch of the voice that vibrates the area. Okay. And let go. We still have a strong arm. I recheck the liver. It's no longer testing. And if that really was a priority, the pancreas should have disappeared. Yeah? Because then if one is causing the other and we treat the cause, then the effect should be gone. So we double check. And I was lucky that actually worked. Yeah. It doesn't always. So if it wouldn't have worked, then we say, okay, we just re-tap on the pancreas. Pancreas is holding here, and tapping here. Okay, so we're done with this layer. So now we get to the second layer again, the brain, the thyroid area, the chest area. This is more forgiving. I don't have to be so specific with the exact location over the organ. The organs that are in distress, it's a 30-degree angle that the light comes out, similar to the cell phone towers. They're emitting at a 30-degree angle. Yeah, and so by the time you get out here, you're catching the small intestine, the liver, the pancreas, and everything. And so, however, if you want to get then to find out which one is it, the advanced people, we do 2 pointing to the organ points, and we know, oh yeah, it's colon or it's liver. So we're fine on the level of the matrix, and now comes the only level that should be difficult for you. It's this one. Yeah, so if this is testing, you can try to find a tapping point, but this is intracellular. The autonomic nervous system, which we're really testing this way, doesn't exist intracellular. Intracellular, we have cellular structures that are not connected to the nervous system. Yeah? And so when we find this, we're purely in the light body. This is not electric, not autonomic nervous system. It's deficient light, corrupted light is coming out. And to correct that, usually we need a substance that carries light into the system. And that's sort of our biochemistry. And at this point, when you're young in our system, you just test the 4 toxins. Let's do that. Let's just do the aluminum, because the aluminum is the most common. And so if you have that, I know we struggle with, some of you have test kits, some have nothing at all. And so on this first level course, we need to sort of either not find a solution, which is absolutely fine. I want you to learn the proper testing, not to focus on the solutions yet. Okay, just hold this, so. And so she is giving us a positive. There will always be 3 or 4 things that testing. Usually when the metals test, there's always a viral presence also. Viruses attach themselves to metal, basically use metals as a carrier into the nervous system. So when you find metals, there's always viruses there and other things. And so, but for the solution, the most important thing is to get the aluminum out. It's the foot bath plus the polmolo. Sometimes coriandolo. So, okay, so we put the problem in the hand that corrects it, but would only correct it for a minute or so, and then she would go totally into blocked regulation. So we take that out, we put the possible solution in the hand and see if that will fix it. And it does, And so I think that's all we can offer to you, If you would leave this enough in her hand, there's actually a way of using this as a treatment. Let's demonstrate that. So you hold this in your hand, and with the other hand, you go through all the tapping lines. You do tap and tone on all the points. Daniela will help you with the sequence. Yeah. By doing that, it puts the remedy deep into your system, because you have the light exchange of the light coming out of the remedy into the palm of your hand. And by doing the tapping, it really speeds up the absorption of not just the information, but also you get some true transfer of remedy into the system. Yeah, the teleportation, as we call that. She does very well. This is the right speed of tapping, the right strength of tapping with a loose wrist, like as if you're playing on a drum. This is not like this. It's really with a loose wrist.
Does it have to be held in the hand?
Did you do this one?
Yeah.
Okay. Okay. And then what you will see, if I was right, is this, that the arm has gone weak. And either we put her into a huge stress, and how do we find out if it's a huge stress?
They should know by now.
Yeah. So while holding this, put both index fingers on the vagus nerve. Yeah. And it does not reverse the weakness. That means it's not a stress that we put her in. And then to counteract, see if it's a healing state, she does the yin mudras. And that is putting her back into strength. That means she is in a healing state. Yeah. So if you work cleanly, very often you can, with one single remedy, put the patient, the combination of tapping, tap and tone, and then remedy testing when you get to the intracellular test. Or, if it's in a matrix, you need a binder. But if it's only testing here, you test the toxins, you test the chronic infections, and usually you come up with one or two remedies, and you can put the remedy in a healing way into the system right away by holding the remedy and tapping it in. We call that you tap in the remedy. Yeah, and if a patient goes in a healing state, it means you work correctly. Sometimes healing states can surprise you halfway into this, and then you have to catch it. When the arm goes weak suddenly in the middle of treatment, you either did something really right or really wrong, and you differentiate it quickly with those two movements. Okay, do you have any questions?
I did have all my mercury removed from the fillings and stuff. Quite a long time ago, 2006.
Yeah. So let me just show the quick. So do you mind getting the mercury?